What I'm trying to suggest is there is somebody who is prepared to join as a testimony. Can I ask that person to start off first?
Okay, no problem.
Okay.
Yes,
Then,
sir. Can you specify that guy's name?
yeah, name is, 1 second, this should be somewhere here. Just meet.
That's Jasmeet Kaur, right?
Yeah, yeah.
Okay, okay. He can unmute himself.
Yeah, hi everyone.
Yeah, hi everyone. I'm Jasmeet Kaur from India. I want to share my experiences with homeopathy. Actually, 5 years ago, my husband was having a gastology problem, and we visited so many doctors, and there were five DMs, and all examined in their own way, and all declared that he is having ulcerative colitis. Then I thought that I should go with homeopathy, and he became absolutely fine. And actually, our Dr. Devinder Singh, suggested some medicines to him, and we just follow those medicines, and my husband is quite well now. So I think that homeopathic is a boon for me, and not only my husband, um, but also my mom. My mom was suffering with cramps in her legs, and same Dr. Davinder Singh suggested a couple of medicines to her, and she also followed the same remedy, and she got well, and I'm very happy with that. With that, my mother is now quite well. Now, from as all you know, from last 1 year, due to COVID, we have to wear masks and all, you know. And my father, who is a businessman, and he has to wear mask all day long. So he started some allergy like sneezing. First he started with allopathic medicine. Then he realized that when he takes medicine, then he is quite okay. Otherwise, when he stopped that medicine, he is in the means he is facing the same problem. But so he thinks that so he thought that he should go with homeopathic medicine. Then I also consult with my doctor, Dr. Davinder Singh, and also he suggested some medicines, and he followed that remedy, and he is now quite well. Actually, he was having a problem of sneezing just because of wearing a mask all day long. So um, now he is quite well, as he followed his medicines, his remedy. And now just I want to say that I also have two kids, and I use nothing but homeopathic medicine also with for my kids. So in last, I just want to say कि homeopathic medicine, homeopathic remedies can be can be effective in both major or minor ailments. Thank you so much.
Thank you. Thank you, Jasmeet.
Yeah, and just to add myself, Ratan Singh, I'm husband of Jasmeet Kaur. So, first of all, thank you so much, for giving us this opportunity to speak. I think homeopathy is actually, magic. I have one incident, and if I can quickly recall that. So one of our, relative, it was, long back, maybe in 2018, I believe, when in India there was like, dengue and chikungunya. So kind of that, that problem was there, and lot many patients were reporting daily basis. So one of our relative, what happened was, like, he had a fever, and all of a sudden, like, his fever was up like 106 degrees, and I immediately called Dr. Devinder Singh. He suggested some medicine. You won't believe that it was like real magic. Within 30 minutes, I would say, his fever was normal. And I mean, it was very hard to believe that how it can happen, you know so it was really, I would say, I mean, really magic. So I think that was one of the incident which I recall. So I believe we have lot many doctors in this forum. So I have one suggestion. We all are talking about, we are talking a lot about this COVID-19. I mean, on allopathy medicines, science, like, science has done great progress, and I think everyone is looking for COVID vaccinations and all that stuff. So I would suggest, like, those who believe in homeopathy medicines, they do believe, like, and they have rather blind trust on this field. So what, like, we want is, why don't we all spread the awareness of this homeopathy medicine, like, those who are not using, or those who don't trust, I don't know what to say. But I think we should do something, by which we can create awareness. And also we should, at the same time, we should discuss something about, like, COVID-19. It has actually ruined everyone's life. So why don't homeopathy medicine, uh, doctors, they talk about some vaccination from homeopathy side. So I think that will be very, very useful to entire world, I would say. Yeah, that's it from my side. Thank you so much.
Thank you. Thank you. Can I ask Gurkirat to join in as a testimony as well, please? 21 Gurkirat. Yeah.
Hello, everyone.
Hello.
Good morning.
Good morning. Good morning.
Can you hear me?
Yes, I can.
Okay, this is Harpreet here. Actually, Gurkirat is my daughter's name. So this is her Zoom login ID, which she's using every day for her classes.
Would you like to share your experience with homeopathy, please?
Well, there have been a lot of experiences I had with the homeopathy, but I would just like to insist on one point, uh, which I have actually personally experienced in my life. There have been many times, I've seen people around, they've been not believing in homeopathy medicine. So they have been to doctors, they've done a lot of tests and everything. Still, there've been no results for them. So in that, there was one of my friend who was my engineering friend, who actually has done engineering with me in my college, and he was having a consistent cough from almost around 7 8 months, and he visited hospitals. He's done a lot of tests, and there were no results. He'd been on medication for so many days. Still, there was no recovery for him. And finally, one day, I told him that you should give an opportunity to homeopathy medicine. Hmm? You tried everything, and since I know you personally as a person, as a character, so I could suggest you some medicine. After inquiring from somebody who is actually having good knowledge of homeopathy. Since I'm not a doctor, but I keep my some time for homeopathy medicines, and I keep reading about them. So I just gave him one very simple medicine, and that's Drosra 30. I gave it to him, and he just took it for 2 to 3 days, that medicine. And then after that is the time, and since the day, he never had that cough again. That's kind of completely cured. And one more thing actually he told me is that after taking that medicine, there was a lot of phlegm which was coming to him, which was coming out actually. And that is what I told him. I said, since you've been taking the allopathy medicine, and it was only suppressing inside, what I actually believe, maybe I don't know if I'm right or wrong, but I just gave him Dostra 30 pills, a small one, 1 gram, and he took it for 3 days. And that is the day. And today he never had that cough. Maybe once, or maybe due to the climate change, he may have it, but that consistent cough is completely gone. And my personal experience with the homeopathy is again kind of same related with the cough. I was having cough and consistent cough, same thing. And I went to the doctor, the allopathy doctor. They gave me quite antibiotics for 15-20 days, and I've been taking the medicines. There was no recovery. And but for myself, I took a different medicine. I took Kali Bichorium 200 for 4 to 5 days, 1 gram, and then I was also through the same phase, and it all got cleared. So there are a lot of people who actually believe that homeopathy medicine does not work, but I just want to bring it to them. It does work, and especially for allergies, it works very efficiently and very well. There's another case of my friend, and who is also my working partner in my business. His daughter was getting allergic reactions on the skin, asthmas and all that. Everywhere, these on the face. It was getting bulging up. So he has to actually quit on his job because he got so tense with the daughter, and he took to so many doctors, and then he actually had to. I think it's luck that he got to meet one doctor who was a very senior doctor, again an allopathic doctor. He said, "See, I can give some steroids to her, and she's very small right now, and but I would suggest that giving steroids is not the solution, because she's very small, and in future she's going to have a problems with that steroids. So I would advise you should go and visit a homeopathy doctor, and this can help you." So he visited a doctor in Hyderabad, and after that, that is almost 95% completely gone. She had some genetic issue, and it's completely gone now. So these have been my experience. There have been many. I think it would be a very large time if I keep on speaking about them. So this has been my experience with my friends, my families, and myself with the homeopathy.
Anything else? Or okay. Thank you very much.
Thank you so much.
Thank you for joining in and providing your testimony. Okay, I am Devinder Singh, the practicing homeopath in UK for over 25 years. So when I receive a new patient, I always try to educate my patient first. First, I will try to explain. I don't know whether they know about homeopathy or not, because sometimes they come to me from word and mouth, and they just know that I am a doctor, but they don't know whether I'm a homeopathic doctor or something else. So I try to educate them that what is homeopathy. So homeopathy, it is a system of medicine in which the symptoms of a patient are treated by medicines which are also capable of producing the same set of symptoms in a healthy human being. So it was discovered by Dr. Samuel Christian Frederick Hahnemann from Germany, and it was based upon the law of similars, which means like cures like. And the reason he had to give up his own, because Dr. Samuel Hahnemann, he was a medical professional. He was MD in his own profession, the orthodox medicine. He was practicing the allopathic medicine for a number of years, and but he wasn't satisfied. The reason being because there were side effects of the medicines when they used to take the medicine in large doses, and there was no cure for the chronic diseases. So he gave up his practice, and he was master of 7 European languages. So in order to earn his livelihood, he started uh, practicing translating the medical literature from one language to other. And he came across a materia medica, which is called as the Coulan's materia medica, which was prepared by a Scottish doctor. And there he came upon a sentence which says that the malaria is treated by cinchona, because it produces the malaria-like symptoms in healthy human being. So the cinchona is a plant which the extract of that plant is used to treat the malaria symptom. And so he paused upon that sentence, and he wanted to find out the truth behind that sentence. So he took the cinchona bark and he consumed it by himself, and what he found was that it does develop the malaria-like symptoms. And so he tried to establish the fact further. So he gave the cinchona bark to his family and friends, and he found the same results. And thereupon he established the curative power of the medicines, that the medicines cure diseases because they are also able to produce the same set of symptoms in healthy human being. So, and this is how he tested all the medicines which were prevalent at that time uh, upon the healthy human beings, and he recorded those symptoms. And then he prepared the materia medica of each medicine, what each medicine is capable of producing symptoms in healthy human beings. So when a patient comes with the same set of symptoms which any medicine has been able to produce on a healthy human being, when the patient is given that medicine, so the illness that gets cured. So, and this was the birth of the homeopathy. So then now there are thousands of homeopathic medicines which has been tested on uh, and proved, and they are all tested on healthy human beings. And so it is not a blind faith, as one of my testimony mentioned, that one can have a blind faith upon homeopathy. So patient can have a blind faith, but homeopathy is not blind. The principles are not blind. So they are these principles have been verified time and again, and they are experimental. It is experimental medicine. It is not based upon the beliefs or myths. Uh, would you like to? Okay. So I've got one of my patient here. Before I continue, I would ask her to provide her testimony. That's Dr. Pritpal Kaur.
Hello there, everyone. My name is Pritpal Kaur, and as a mother, I have used homeopathy for more than 20 years. Prior to that, I was using allopathy. For example, I used to go down with colds and flus very frequently, and the cold and flu-like symptoms would last approximately 5, 7, 8, 9 days using allopathic treatments that was taking amoxicillin, which is a type of penicillin. It's an antibiotic. But when I started homeopathy, I didn't know very much about it. When I started taking homeopathic medications for my colds and flu-like symptoms, the frequency and the duration of the colds and the flus, they actually reduced. So the frequency I was getting less often, and the duration went down to something like a couple of days, which was very bearable. And the intensity was considerably less as well. So that was one thing. That's one of my experiences with homeopathy. Secondly, several years ago, I fell down from my front doorstep onto the paved area, and I landed on my right side. And I thought I'd hurt my right shoulder and my right leg, and because I started to limp. And so I was prescribed arnica for my fall, and I took that, but I decided also to go to the hospital to ensure that I didn't have a fracture in any of my limbs, particularly my right arm or my right leg. When I got to the hospital, the physiotherapist did some checks on my leg and my shoulder and my right arm and said everything was okay, but he said, I've probably pulled some ligaments, and he gave me crutches to walk with as I was limping very badly. Now I took the crutches. The doctor and the physio said, please take some ibuprofen. And I know how ibuprofen works at the molecular level. But I decided, I had taken arnica and I was starting to feel better. The physiotherapist at the hospital said, this is going to take approximately 1.5 months, approximately 1 to 2 months for you to recover fully. He said, take ibuprofen and so on and so forth and use the crutches. Well, when I came back home, I spoke with the homeopath, and I also took some Rustox as well. I refused mentally that I was going to use the crutches, and I was sort of walking around just sort of helping myself, using my hands against the furniture to support my body. I did it like that, but I recovered. I had to take the crutches back to the hospital because they needed the crutches for another patient. I took the crutches back, and the physiotherapist was surprised to see me back so quickly, because he said he thought he was going to see me about 1.5 to 2 months time. I was back at the hospital about a week later, and I said, well, thank you for the crutches, but I didn't really need them. And I also explained to him that I had taken some, homeopathic medications, arnica, Rustox, as was, suggested to me by the homeopath, and my recovery was that much faster. And then my third experience with homeopathy was that I regularly started getting, for the past few years, sneezing spells when I would sneeze. I'm not allergic to dust or anything, but whatever reason, I would sneeze like over like a course of within sort of a couple of minutes, I would be sneezing continuously, and I would end up with a cold and loss of appetite, and then 3 days or 4 days would be no sneezing, and then it would come back on again. And this was mostly happening in the winter time. And although I was used to, for example, taking sort of traditional allopathic medications, I decided I would take some homeopathic medication, and the homeopath prescribed to me a medication called influenza, which is very powerful, and it gave me almost instant relief. The sneezing stopped, and there were no side effects, and I felt really good. I felt energized again to continue with my work. I also have used homeopathy for vertigo, so I occasionally get dizzy spells, which I think is probably because of perhaps something wrong with my ears, I've been told by my doctor. But the doctor prescribed to me, my conventional GP prescribed to me, what was it? He said, oh, put a couple of drops of olive oil in your ear and you will feel better. Well, I decided not to do that, and I actually spoke to the homeopath, who said, well, take this particular medication, and yeah, the recovery was very good and I felt fine. So overall, I would say that I come from my background is in chemistry, so molecular chemist. So and I've also worked in the pharmaceutical industry, so I know how medications are prepared and how drugs are developed and so on. And so I feel that homeopathy has a lot to offer. People don't fully understand how it works, but hey, if a medication can give relief to the patient, does it really matter how that medication works? Indeed, even if we look at a simple example of, say, aspirin, they don't really understand fully, at the molecular level, how this medicine works. They don't fully understand it. And allopathy, there are instances it does work perhaps, but the side effects are enormous. Homeopathy is safe, it's gentle, and the recovery times are so much greater, so much quicker, I would say. And that is all I have to say. I have very good friends who use homeopathy, and they use it very well. They've had children who have not been vaccinated at all, and those children are thriving. They're now, teenagers, and some are older, adults with children as well of their own, and so on. So I really do think where you've got a system which enhances the body's immune system, improves it, so it's a lot healthier, and so it can combat disease. That's the way to do it. Whether we understand anything at the molecular level, that's a separate entity, but if the patient feels better sooner and quicker without any side effects, I think that's the way to go forward. Okay, so thank you for listening. Are there any questions? Okay, thank you. Hope you have an enjoyable evening or morning. Thank you.
Okay, so I was trying to discuss about how I educate the patients on their first visit before even they start explaining about their illness, etc. So normally sometimes they say, is this a herbal medicine or desi medicine? I said, no, it is not a herbal medicine. There are herbs which are used to produce the medicine, but there are substances other than herbs as well. For example, the metal, the nosor, the sarcodes, etc. Yeah. So that's how I educate them. Well, so I'll just tell about my own experience about homeopathy. When I was a student, I was doing my diploma course in homeopathy in Chandigarh. So I was in third year of my academic year, and I fell ill, and I had the uh, it's a malaria-like symptom, malaria-like fever, which was on alternate days. I used to suffer from fever with chill, heat, and sweat. And I went at that time, I didn't have much knowledge about homeopathy, what it can do or what it can't do, but our family was still going with the orthodox system of medicine. So I went to the local practitioner in allopathy. So they first tested my blood, and they didn't find anything that it was a malaria. So although they couldn't test the malaria positive, but they still gave me the medicine. First they tried chloroquine, and then they gave me the metacin. So none of the medicine worked. So it was over 2 weeks, and I was feeling very weak. I couldn't eat, and I was in bed at that time. So one of my friend came from the college, and he informed our teacher who was teaching us the materia medica at that time. And when my teacher came, he came to my house and he examined me, and he took down the history, and all he gave was, there was a one dose. I didn't know what he gave me, but he gave me just one dose. And the same night, I was as energetic as ever, as if I have had no fever at all during the past 2 weeks. So the recovery is so fast. So that's what I can say. So, and from that time onwards, so I had developed my deep interest in homeopathy, and it never failed. So I would just going to discuss about a case when I went to India, and one of the taxi we were using to visit around places in India. So the taxi driver, went from the conversation, he found that I am a doctor. And when he finished the visit, and he wanted to discuss his case, and he had his the diagnosis already with him, the laboratory report, and he said that I'm suffering from diabetes. Can you do anything about it? And I said, I can't say anything. So you tell me what you are suffering from. So time and again, I asked what he was suffering from. He was just producing the report in the lab test in front of me that I've got the diabetes. Uh, okay, I said, okay, uh, put aside the laboratory report and let me find out what you are, if you haven't got the report with you, and what symptoms do you have? Hmm? So again, he said that it is I'm suffering from the diabetes. Hmm? So ultimately, I asked, what made you to go to the doctor to get this lab test done? Hmm? So then he explained that, okay, I've got uh, I'm obese and I haven't got the hunger. Although he was obese, but he hasn't got the hunger. Hmm? And then he was feeling weak. And I asked him, does he do any exercise? And which from, he said he hardly walks a few steps when he drops somebody off. And that's what it, so this was his lifestyle. And then on further exploration, he said, I've got the nocturnal emissions, and I've got the lack of willpower to be with my wife. So, and so on. So that was the trigger point for me, that it is not actually the diabetes, and it is actually, there are underlying condition which is suffering from, and that this is what is giving out the result of the lab test. So I took down the case history and I found that lycopodium is the medicine suitable to him. So I gave lycopodium. I didn't have the medicine, but I write down the prescription for him to purchase it and then let me know. I left my contact details with him. So he took down the lycopodium and only one dose. And after about 3 months or so, I received a call that I'm I've got no diabetes now, and my the sexual power has also regained, so I'm fine now. So what I mean to say is that sometimes, not sometimes, but most of the time, I rely upon the symptoms which a patient presents to me rather than their laboratory reports or diagnostic tests, etc. I always emphasize on the symptomatology, and I always extract the symptoms of the patient first. So this is how I practice homeopathy. So there was a uh, there was another case of a teacher about 60 years, female. She had the irritable bowel syndrome, chronic diarrhea, pain in the finger joints, loss of weight, doesn't want to go out. She felt secure within the house. She was a chilly patient. So these were the symptoms she narrated, and she was suffering from about 15 years from these complaints and tried various other methods of treatment. None worked. But when I took down the case history and I prescribed Calcarea 200, and it was a much better response this time. So the diarrhea that has stopped, which was she was suffering from many years, and all other complaints slowly and slowly they went away as well. So she came to me about 2-3 times more after that prescription, but she's absolutely fine now. I've got another case of a athlete who was about 59 years of age, and he had the edematous swelling of the feet. So he used to complain that whenever I finish my run, come back home, rest, and then is the time when the feet starts swelling. So I asked him that, is this a swelling which is painful, or it's just a swelling? So it was not painful. So, and I asked him to press the swelling and see whether it leaves any mark over there. So it happened to be a pitting edema. So that means whenever you press that swelling, so it leaves it takes time before the skin regains its surface. So so I asked about the blood pressure or the urine. So there was no kidney involvement. So there was no blood pressure abnormality. So couldn't find anything for this case apart from going through the repertory and found Digitalis 30 was the suitable medicine. So, and after that, I gave the Digitalis 30 one dose for 1 week. And then I asked him to stop. And then about a month ago, he just phoned me, but he wasn't talking anything about the feet, the swelling of the feet, but he started narrating something else. So I asked about the swelling and then he said, okay, it's gone now. So that what I'm trying to say is, when a person gets cured, they forget about their own illness. They forget whether the illness existed or not. So such is the curative power of homeopathic medicine. There was another case of a male about 61 years of age, and he was retired from defense, and he had the hay fever and dust allergy. So he mentioned that there was some building work going on within the house, and whenever he went into that room, so it brings a bout of the sneezing, lacrimation, burning in the eyes, etc. So at that time, I could think of two medicines, the influenzinum and sabedilla. So I tried influenzinum first, 30, and for 1 week, 30, one dose daily for 7 days. And after about 2 weeks, he was fine, and there was no recurrence of the hay fever or hay fever-like symptoms. So hay fever, I'm just saying it is hay fever, but I especially concentrate on these symptoms, irrespective of whichever underlying ailment it is from. But I always emphasize on the symptoms. So this is what guides me to the selection of the medicine. I've got another patient who was suffering from eczema all over, from head to toes, and for a number of years. He was 30 years of age, and he uh, wasn't he was off work, and he wasn't willing to start work until the eczema gets cured. So he had tried homeopathy before as well, uh, from India, but he wasn't satisfied. So he managed to find me, and I took down the history first, and it was, I think, one of the most difficult case for me to take down the history and then to give him the treatment and the follow-up treatment. So I the symptoms were the burning, itching, scratching, amelioration, warmth. So and on that basis, I gave him the arsenic alb. But moment, I think about a couple of days ago, and he started asking more and more questions. What is happening with each symptom? When is it is going to get cured, and so on. And then he said, I wanted to start my new work, and he gave me the ultimatum as well, that if I don't get cured by such and such date, then I'll go to some other homeopath or other practitioner. And ultimately, there was, from my point of view, there was improvement. So his skin was cleared. Only thing was the face and the neck. So the eczema uh, was located on the face and neck. The rest of the body was clear. And based upon his symptoms, so I gave him the opium, and after that, I just heard one call, and he never came back. But I can see now, about a year later, now he's not satisfied from the other practitioner as well. He perhaps trying to seek advice from me whether that practitioner, whatever the treatment he is giving, is he giving the right treatment, or uh, perhaps I could judge that he's trying to come back to me, but I didn't give any positive indication. I said, wherever you are, if you can continue getting your treatment from where you are. And if there are any difficulties, or if you feel unhappy and come back, then most welcome. But otherwise, I would like you to stick to where you are at the moment. So that's my experience about this patient. Okay, I've got another patient who was a professional singer, about 65 years of age, and the only thing he mentioned was that I've got the weakness in the left arm. There was a tingling and numbness in the tips of the fingers, and the weakness is gradually coming, is going upward. Hmm? So these were the only symptoms. I tried to extract the other symptom. So everything else was normal: appetite normal, sleep normal, thirst normal. The rest of the energy level is fine. So based upon that symptom, I gave him phosphorus 200, and within a 1 week, he mentioned that I am better now. So he didn't need another medication or even the repetition. Yeah, another, it was a professional, he was an accountant and 35 years of age. So he had the pain in the abdomen around navel region. And the pain used to get intense to the extent that he had to double up. So he had to move his knees right up to his chest in order to get the relief. Hmm? So these were the symptoms. So he had uh, got all the tests done, the ultrascan, the endoscopy, and various types of x-rays. So nothing was visible. Hmm? So, so there was no indication that he's, sorry, 1 second, please. Yeah. So the diagnosis couldn't be established, but the patient, he was in much agony. He had to stop his work and came back to his hometown and very worried what will happen to his family, young children, and ultimately what I found was from a brief talk that he was assigned a new project. And so as he was not familiar with that project, he was very worried whether he would succeed in that project or fail in the project. So that was the most worry he had. Uh, so based, and the other was, the modality was the complaint used to aggravate between 4 and 8 p.m. So that was the peculiarity. And taking these symptoms into consideration, so I gave him, first I tried Colosynth 200 because he was doubling up with the pain, and it didn't work. Hmm? And so at that time, I tried for a couple of days, no effect. So then I asked him to take Lycopodium 1M. So the what I his reply was, the moment I put Lycopodium 1M on the tongue, so within minutes I felt the relief. Hmm? So as if the pain is all gone and all worries are gone. So it, such fast acting a homeopathic medicine can be, even in chronic or in severe conditions. Hmm. Yeah, I've got another patient who had the pain in the chest. He was also an athlete, but he said occasionally I experienced pain in the chest. And the way I asked him the location of the pain, and he just pointed out with a finger, with one finger. He said, the area which is covered by a fingertip, this is where the pain is. It doesn't go anywhere else. So that was one guiding symptom I had in from the patient, and based upon that guiding symptom, I prescribed him Calibike 30, and with one single dose, and the pain was clear, and he never had the repetition of that pain again. If anyone has got any questions so far. One second. Okay. I'll see if I want to explain more cases or not. So I would just say that yes, there are some critics of homeopathy. They say that this is unscientific. mm, it hasn't gone through the controlled experiments, etc., and so on. But my philosophy is, so as long as a system works, we don't need to go into the argument of or trying to waste our energy in establishing whether the system is scientific or unscientific. So as long as it has experimentally, it has proved right from time and time again, from children to right up to the adult. They have treated families with from even from the pregnancy onward, and their children I'm treating from dentition and right up to the young age as well. So every time it works. So I don't need any scientific justification in order to prove myself that I am practicing the correct medicine or not. Hmm. So it has worked upon me. It has worked upon my nears and dears. It has worked upon the patients from all ages, males and females. I've got another patient uh, who had the uh, weakness in the limbs. Hmm. So he is about 80 years of age, is retired teacher, and there were um, some changes within the spine, and on the basis of which he was asked to get the operation done, otherwise he can lose his legs. So I treated him for about 3 or 4 months. Hmm. Uh, he the back pain, he had the back pain. There was a, when he used to stand, the standing was the worst posture for him. And the moment, so he used to start experiencing tingling in the toes and weakness in the toes, and there was a feeling as if the legs aren't there. So he was without legs. So, and it was a dangerous situation for him. So I treated him about 3 months, but ultimately there was a pressure from his colleagues, etc. So some were positive and some were negative. So he decided to have the operation done, and initially he was fine, that there was no sciatica now, and he can walk. But as soon as the effect of that medicine is gone, so now the weakness in the limb is still there. He can't walk as much as he was able to under the homeopathic treatment, and the back pain is constantly there. So after having a talk with him, that he said I would have been better uh, had I continued getting the treatment with homeopathy. Um, 1 second. If Nair is, say, would you like to join? Nair, would you like to share your experience? Padma Priya?
Sorry, sir, you say any name?
Yeah, I'm just asking you. I don't know whether she's prepared to join in or not. I asked her earlier, but I've got time now. Yeah. So if she is willing to join, she is most welcome. Nair is her name. You can ask if she's willing to join or not.
Yes, yes, sir. I can hear you, but unfortunately, I'm outside. I'm not on my laptop and my device, so that's the reason I'm not able to join. I'm very sorry, but I am listening to you, and
Okay.
I'm very sorry. I can't join you through the gadget or turn on the video and all.
Right. No,
I'm on the mobile and I'm outside.
because we can hear you. So if you want to continue speaking something about homeopathy, that will be nice.
Yes, yes, yes. Is the audio clear, sir?
Yeah, it's very clear.
Yeah, it was really great, sir. You had a very great experience of practicing homeopathy in this country in such a long time. And I think it was a great privilege to hear to you so many cases at a stretch. And I think we all at IFPH should really appreciate the efforts taken, because within a short duration of time, you prepared yourself in such a way that you could really give us a grand tour of your entire cases. That was really appreciated, sir. Thank you very much.
Okay, thank you. I didn't prepare, but I just
No,
picked up.
I mean, see, yeah, that's what. Without any notification, you sounded as if you're very much prepared, very well in advance. So that's really appreciated, sir. So it talks a lot about your experience and your confidence in this field of homeopathy. So really appreciate it. Thank you very much, sir.
Thank you.
And I'm sure, from all the cases and all the experiences that you have, I'm sure because IFPH is all about promoting homeopathy worldwide, and we have so many participants listening to us every day on the Zoom session, so I am sure the panel members would like to approach you so that we can get to learn more from you and hear more of your cases in future. I'm sure they will consider this, and we can hear more from you, sir.
Thank you. Thank you.
Thank you, sir. Thank you very much.
Thanks. I can explain another case, which is about for a person who is about 55 years of age, and he works in a store here in UK, and there was a issue of the anal fistula. So he tried, I think there are surgical methods he tried to get himself cured within the NHS, but he wasn't satisfied. So the wound, the abscess wasn't healing itself. So, and he came to me, and when I took down the history, he said I had the diarrhea and loose motions 3 times a day. It was a painless diarrhea, and for about 3 months it continued. And thereafter, he found that there's an abscess, and when they examined the abscess, and it happened to be a fistula. So upon taking down the history, and I gave him the Cilicia 200, one dose once in a week for 3 weeks. And after 4 weeks, when I examined him, and there was the pustular discharge was still there, but it was significantly less. And after that, he hasn't come back to me, but I saw him somewhere, and then he said that I'm fine now. Okay. So there's another patient. He was a child, about 5 years, six years of age, and the mother used to complain that whenever he is in the car, and he must vomit. So either open all the windows, and if you keep the windows closed, so he must vomit. So when I examined him, so there was a clean tongue, there was no other symptom apart from cough and discharges from the eyes, nose, and mouth. So based upon that, I first tried the coculus, and followed by arsenic alb 200 one dose only. And with that, the cough and other discharges from the nose and mouth, so they all cleared, and I haven't heard that he is experiencing the vomiting like symptoms during the car ride. Okay, that's the case of vertigo. Yeah, that's a lady about 40 years of age. So since 10 years, she had a cyst. Uh, she had a cyst on the skin of the head, on the scalp. Hmm? And it, because it used to get, she was embarrassed by the size of the cyst, so she got it operated. And after that, she started experiencing vertigo. And whenever she used to lie on the right hand side, and this is when she used to experiencing the vertigo. She was also putting on weight. So she had the cesarean section on the second child. So because it was a right-sided complaint and I couldn't extract any other symptoms, so I prescribed her Lycopodium 200, 4 pills uh, every 7th day for 3 weeks. And she hasn't come back to me yet. Uh, because sometimes what happens when the patient gets cured, so they don't call back. And I have seen examples that patient who has had just a on the first visit, when they take the treatment, and then they forget about anything else. And after a year, I just try to follow up, that just to find out whether the patient is feeling fine or not. They said, I am everything is fine. So my life has changed. So this is the expression sometime I receive from the patients. Okay, that's a child about 15 years of age, female. I am treating her right from the young age, but it was recently about 6 months ago when she came back to me with the itching in between the fingers and aggravation in the winter. So there was dryness in between the fingers. The hands were sensitive to temperature. And so based upon that, I was able to prescribe her the graphitis. Graphitis, it worked to some extent, and then I found out that the only time when the condition gets worse is the winter time. So I gave her petroleum 200, one dose, and now she is fine. Right. I've got another case which is about from UK. He's a professional, IT professional. He's he's got the cysts all over. There was no pain, no itching. The only sentence he mentioned was, "It's a weird. It looks weird, and it is growing big." Hmm? So that was his only concern, and his sleep was fine. Uh, uh, Appetite is fine. I couldn't get any more symptoms from that. So I prescribed Thuja 34 pills in the morning to be taken once in a day for 1 month. And I'm still awaiting the response from him. Okay, that was a case of a person who had the fever. He is also from UK and he works in a building industry. So when he came to me, so he had the temperature and he was breathlessness, and he when he used to ascend he go upstairs, he used to become breathlessness. There was also diarrhea when he came back from India. So these were the only symptoms. There was a chill, there was a thirst was increased, he was anxiety during the fever, urine was fine, bowel was irregular and loose, and weakness and restlessness. I think this was during the corona period. So I understand that he was more worried about as if he's suffering from corona, but I didn't look at any diagnosis or any tests, etc. So I just based my prescription upon the symptoms he presented. So I gave him the arsenicum alb 1 m, 1 dose only. And I asked him to come back to me after 1 week. He didn't, but then about 3 or 4 weeks after, I met her wife, and she mentioned that he is fine now. So he didn't feel the necessity of ringing you. So this is what I'm trying to say. When the patient they get better, they don't bother reporting back that they are they're cured now. And within my family and friends, so many people are worried about the corona and COVID. So all I mentioned to them was that from my point of view, I just gave them the, if somebody is worried, so I give them the arsenic alb only, yeah, and arsenic alb 30 for about 1 week, and I haven't had any case where those persons who have taken arsenic alb 30 for 1 week and they've developed any symptoms of corona. I've got Gagan Singh here. If would like to participate as a testimony, who was recently treated by myself. Could you please allow 1 second? Let me try if I can unmute you. Gagan Singh, go ahead, please.
Hello, hi, good evening, doctor, and good evening all. Basically, just a quick word. Have not done this before, many experience, but I really wanted to say a big thanks to Dr. Davinder Singh ji, and the overall just wanted to say thanks to the homeopathy, basically. I've recently had a problem with my, just on my palm, basically, had a bruising and it was just gone all blue. So obviously, Dr. Davinder Singh ji gave me this medicine called Arnica 200C. Even before that, I remember, obviously, when I was in India as well, I've been taking on and off the homeopathy medicine, and it really helped me a lot with everything. Even Dr. Davinder Singh ji also suggested me in the past to do with the thyroid and issue with the little bit weak immune system and a little bit of problem with the digestion as well. So they gave me the various medicine. They, they suggested the lycopodium in the past, and also gave me some medicine for the headache as well. So all I would say is just I really wish people had a more trust on homeopathy. I know in India we are still have a good level of trust, but in the UK, what I can see is I don't really see so much of, like trust. People have this level of trust in homeopathy. So yeah, I would say I really need to raise a more awareness about how good is the homeopathy is. So I just wanted to say thank you. Basically, that's my main reason to join. I just wanted to pass this thanks gesture to everybody, and thank you, everyone. Thanks a lot.
Thank you. Thanks ever so much. Okay. Yeah. Okay. Thank you very much, Gobind Singh, for contributing as a testimony. Any persons have got any questions so far?
Hi all, if you have any questions asked to him, please raise the hand.
All I would say is that homeopathy, it is a complete system in its own, and my feeling is that it should be allowed more presence in the national health system within the UK, so that the ordinary people at large, they can benefit from its the beneficial effects, yeah, because there are hardly any side effects, and it works very well on children, young and adults, and of course both the sexes. It is a shame that in this country, so the there were some hospitals which are purely dedicated as homeopathic hospital, which are being closed now, and they are being converted into integrated medicine centers rather than exclusively for homeopathy. So, and it will save, I think, a huge amount of money for the National Health Service as well if they utilize the services of homeopathy, because the homeopathic medicines are very cost effective and are very, and it provides the long-term stability of the health. So it builds up your immune system rather than suppressing your symptoms. So it is a win-win situation for everyone. So if homeopathy is adopted largely within the NHS system. So I think that's all I have to say. And I think the next person, they can switch over.
Hi, sir. One of the participant, Miss Marianji Salcido, raised the hand.
She raised the hand. Where is Maria? Okay, 1 second.